My name is Amanda Boyer and I'm going to be doing NG tube insertion, clot, and removal. This is my surroundings. Okay, hi Mr. Jones, my name is Amanda. I'm going to be your nurse today. And can I please have you state your first and last name, please? Good, and your date of birth? Perfect. Okay, so the doctor had come in and he had talked with you about the stomach pain and swelling that you've been having. And he's asked me to insert an NG tube, and it goes through your nose and it goes into your stomach, and we'll hook it up to the machine here, and it'll pull the contents, some of the fluid and air out of your stomach to help with that pressure and bloating. Does that sound okay to you, Mr. Jones? Okay, good. So first off, we're going to wash our hands. And Mr. Jones, have you had any surgery to your nose, or have you ever had any trauma to your nose? No? Okay, good. Well, Mr. Jones, I'm just going to look up your nose with a little light to see which side would be the best side to use. Okay? I'm looking for any polyps or deviations. Good. Okay, Mr. Jones, we're going to cover you up with the chucks here so that if anything were to happen, if you were to feel like you were going to throw up, or if you had any drainage, we'll catch that on here. We have the emesis basin here for you, so if you do feel like throwing up, we'll try and hit that, okay? I have a cup with some water over here so that a little bit after, when I start inserting the tube, I'll have you drink from that. And then I have Kleenexes in case your eyes water or if you do spit up. Okay? I'm going to go ahead and I'm going to get my tubing. And Mr. Jones, we're going to measure the tubing. So I'm going to put the tubing at the tip of your nose, then I'm going to go to your earlobe. Then I'm going to go from your earlobe down to the bottom of your sternum. Perfect. And we're just going to mark that with a piece of tape here. Okay. I'm going to bend the tubing just a little bit to try to go with the curve of the nose. And Mr. Jones, I'm going to insert just the first couple inches into your nose, and then I'll give you a little bit of a break, okay? So I'm going to lubricate the tip of my tubing. I'm going to have you look straight ahead, Mr. Jones, and we're going to go right straight into the nostril. And we're going to give you just a second here to catch your breath. And then I'm going to go ahead and hand you this cup with the water, and I'm going to ask you to move your chin to your chest and take some sips, and every time you sip I'm going to advance the tubing. So sip, 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 sip. Good. And we're just going to hold it right there, Mr. Jones. I'm going to get my tape. I'm going to tape that to the top of the nose. Okay. Okay, Mr. Jones. I'm going to go ahead and I'm going to tape, and I'm going to look in the back of your throat if I can have you open. Okay, I'm checking for any coiling in the back of his throat. Then I'm going to go ahead and I'm going to take 10 cc's of air. And I'm going to insert the air in the circulation. Okay, good. And then I'm going to go ahead and I'm going to pull a small amount of stomach contents out. And I'm going to go ahead and I'm going to put that on my pH strip. And I'm going to discard my syringe and get a clean one. And my pH is below 6, so I know that I'm in the stomach. I'm going to go ahead and I'm going to hook this end up to suction. And then I am going to, with my clean syringe, take 10 cc's of air. I'll turn the suction on. And I will take my 10 cc's of air and push it in my blue tubing to get that suction away from the stomach. I'll replace my valve. I'll make sure that my tubing is taped securely to my nose. Okay, Mr. Jones, you're all set. I'm gonna pin this to your, tape this to your gown. Use a piece of tape and pin it, making sure that he still has enough range of movement so that he can turn his head. Okay. And I come back a little while later and I see that the suction is no longer getting anything. So I will go ahead and I will turn the suction off. I will again perform hand hygiene, put clean gloves on, get the patient's name, date of birth. We're going to go ahead and we're going to listen while we push 10 cc's of air. And the air will not move. I'm going to go ahead and try and pull stomach contents and nothing will come. So we're going to go ahead close this off. We're going to take 20 cc's of water. And Mr. Jones, I'm going to put this water into your tubing. I'm going to pump it back and forth, and we're going to try and get rid of that clot that's in the tubing here. I'm going to pump it back and forth until the clot is gone. Okay. And when the clot has been removed, I'll go ahead and discard my dirty syringe, get a clean one, and we're going to take 10 cc's of air again. Here a whoosh, we'll know we're clear. We're going to go ahead and hook that back up to the suction and turn the suction on. Once the suction's on, we're going to take our clean syringe and we're going to put 10 cc's of air into the blue tubing to get that away from the stomach again. Okay, we come back, and Mr. Jones's, your NG tube is to be de-seed or taken out. The doctor has written an order, so if I can get your first and last name, date of birth, perform hand hygiene, don new gloves, and we're going to go ahead and I would listen to all quadrants for bowel sounds. Making sure that I hear them in all 4 quadrants. Okay, Mr. Jones, I'm going to flush your tubing with water and then with air, and then we're going to pull your tube out, and when I pull it out, I'm going to ask you to take a deep breath and to hold it, and we'll pull that tube out all at once, okay? So I'm going to go ahead and I'm going to draw up 20 cc's of air. I'm going to draw up 20 cc's of water. I'm going to remove the plug on the... No, I'm not. I'm not going to draw this up. I will remove the plug. I will get 10 cc's of air, and I will check for placement. I hear the whoosh. I will pull 5 cc's or a small amount of stomach contents, and I will put it on a pH strip. I will make sure that we are below 6, which we are, so we are in the stomach, so I can remove the tubing. I will drop 20 cc's of air and 20 cc's of water. I will remove my plug, place that I will hold my syringe so the water will feed through first and then the air. So Mr. Jones, I'm just pushing water through your tubing to clear out any of your stomach contents that might be left in there. And then I'm just going to push the air through the tubing to make sure that there's nothing in there when we're pulling it out. I'll go ahead and I will clamp that off again. Okay, we'll unpin this from your gown. And Mr. Jones, we're going to take, and I'm going to untape this. And Mr. Jones, I'm going to have you take a deep breath. I'm going to have you take a deep breath and hold it, 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 hold it. Okay. I'm going to check to make sure the tip of my tubing is there. And I'm going to go ahead and clean up my mess. I'll provide oral cares, and then I will chart.